subscribe to our YouTube channel, and don't forget to hit the bell icon.
Hey there, welcome to She the People TV. This is Dr. Theertha Shetty. You also know me as the Forward Gynecologist on Instagram. Today, let's talk about everything that you need to know about the IUD. When can you get an IUD and what can you expect from the appointment for the IUD insertion? It is advisable that you get the intrauterine device inserted during the first 7 days of your period. Its advantages are that a pregnancy is ruled out and the cervix is open, which helps in a smooth procedure. The procedure of inserting the intrauterine device is an outpatient one, that is, it is done in the OPD, and the entire procedure will take not more than 30 minutes, with the actual insertion taking only about a minute or two. What can you expect following the insertion of the intrauterine device? You may have some cramping or some abdominal pain immediately following the procedure, for which your doctor will give you medication. This will usually subside within 3 to 4 days. There may be some changes in your menstrual cycle pattern, that is, you may have some heavier bleeding, or you may also have some intermenstrual spotting, but it should not happen for more than 3 months. Who should not get an IUD inserted? If you suspect that you are pregnant, if you have an infection following an abortion or following pregnancy in the past 3 months, if you suspect that you have a sexually transmitted infection, if you have a history of uterine or cervical cancer. Copper-containing IUDs should not be inserted in those with a history of Wilson's disease or those with a history of a bleeding disorder. Progesterone-containing intrauterine devices should not be given to women with a history of breast cancer. When can you get the intrauterine device removed? You may get the intrauterine device removed at any time if you are uncomfortable with the device or following the expiry date of the intrauterine device, which will be told to you at the time of insertion. The removal is also an outpatient procedure. The threads of the intrauterine device are usually left hanging outside the cervix, which you will not feel at all. Your healthcare provider will hold the threads gently and pull out the intrauterine device. If you wish to get a new intrauterine device inserted, the removal and the insertion of a new one can be done in the same sitting. When should you contact your healthcare provider? You may contact your healthcare provider if your bleeding is heavy and has been happening for more than 3 months, if you have severe abdominal pain or cramping, if you cannot feel the threads of the intrauterine device, or if you feel your intrauterine device is expelled or misplaced. For any queries with respect to the intrauterine device, always contact your healthcare provider and nobody else. Stay safe, stay healthy, and do not forget to subscribe.
Subscribe to the YouTube channel and don't forget to hit the bell icon so that you don't miss any videos by us.